Hi, my name is Tanika and I'm your student nurse. I am going to do some trach suctioning and trach care for you today. Let me take a look at your armband. Make sure I have the right information. John Doe 101874. That is accurate. I'm going to provide privacy. I would like to lift your bed up. Mr. Doe, I am going to listen to your lungs. I'd like to get a baseline of how they sound before I get started. I'm going to have you cough. Would you mind coughing a little bit for me? Maybe get some of those secretions moving. Very good, thank you. All right, I'm turning my suction on to continuous monitoring, and I am turning up the oxygen. All right. Put this down. There we go. All right. A little hand hygiene. Okay, I need to pull down your blankets a little bit to listen to you. Yes, I can definitely hear some congestion, and suctioning will probably make it feel a little bit better. So, just a second, we'll leave this on, keep you hyper-oxygenated, and I'll get all my materials ready. Alright, should let me move this over here and figure out what would be best here. Alright, put a little saline in there. Okay, so I will put on my sterile gloves. Get my catheter out with my dominant hand. I'm going to hold the earpiece that I will put inside the trach. With my non-dominant hand, I will attach my suction. Okay, it is attached. And I'm going to make sure that the suction is working properly. So I'll test it out. properly. Okay, Mr. Doe, I'm going to need you to take a deep breath when I put the catheter inside the trach. I will tell you when I'm ready for that. I'll also be checking for signs of hypoxemia, make sure that the pulse ox is looking good. So we're going to get started. There will be a little bit of discomfort possibly as I am suctioning, so I'll move very quickly, no more than 10 to 15 seconds. And so let's get started. I'm going to remove your oxygen with my non-dominant hand. If you could please take that deep breath now. Very good, thank you. I am inserting the catheter 6 inches. I am now suctioning. Very good. Very good. All right. Did a good job. Now I am going to listen to your lungs just to make sure. But I want to make sure that you stay oxygenated, so I'll put that back on. And I'm going to listen to your lungs. Okay. See if you sound better. Yes, you sound much better, so I do not have to suction again. While I had this catheter in, I was making sure there was no signs of hypoxemia. And I am now done with the suction. So I'll turn it off, and I will discard these items. I will do hand hygiene again, because now we are going to move into trach care. Once again, I will apply sterile gloves. Move my pinky over. Yeah, I'll take care of it this way. Okay, so now I am going to remove the oxygen. I am going to remove the cannula. I'm going to place that in my saline. I will get all of my materials out. So the first thing that I will do is clean the cannula. Then I will rinse it. Now I'm going to dry it. Discard that. And now I will place the cannula back. I am still assessing for hypoxemia, so I'll put the oxygen back on. And now I am no longer sterile. So my next step will be to remove this old trach cloth. I will clean the top of the stoma. I will assess for redness or can't remember the other term. I'll just make sure that everything looks appropriate. Toss that. And then I will clean underneath. Dry around the stoma, and again I'm looking for the redness, any irritation. Okay, now I can apply a new clean cloth underneath. That will remain. I am going to remove the oxygen briefly to put on my tie. I am going to make sure not to remove the old tie until I have this on. Almost done, Mr. Doe. You're doing a very good job. Excuse me. Excuse my hands. There we go. The ties can definitely be a little tricky. I will toss this old tie. I want to give you some time to get some oxygen. I've watched, obviously, for he did not have any hypoxemia. I would take a good look at him, look at the pulse ox, and then I would document the procedure, and my patient tolerated the procedure well. My one last step, I just want to listen to his lungs one last time.